Asthma is a complex, chronic condition that involves the airways in the lungs. Here are more detailed aspects of asthma. Pathophysiology: inflammation. The linings of the airways become swollen and inflamed, making it harder for air to pass through. Bronchoconstriction. Muscles around the airways tighten, further narrowing the airways. Excess mucus production. Increased mucus secretion can clog airways, adding to the difficulty in breathing. Symptoms: shortness of breath, difficulty in breathing, especially during physical activity or at rest. Wheezing, a whistling or squeaky sound when breathing. Chest tightness, a feeling of pressure or tightness in the chest. Coughing, persistent cough, often worse at night or early morning. Triggers: allergens, pollen, dust mites, mold, pet dander. Irritants, tobacco smoke, pollution, strong odors, chemical fumes. Exercise, physical exertion can induce asthma symptoms. Weather, cold air, changes in weather. Infections, respiratory infections like colds and flu. Emotions, stress, anxiety, or intense emotions can trigger asthma symptoms. Diagnosis: medical history, detailed discussion of symptoms and family history of asthma or allergies. Physical exam, listening to the lungs and looking for signs of asthma. Lung function tests, spirometry, measures the amount and speed of air you can inhale and exhale. Peak flow meter, measures how quickly you can expel air from your lungs. Management and treatment: medications, quick relief, rescue, inhalers, short-acting beta agonists, e.g. albuterol. 2. Quickly relieve symptoms. Long-term control medications, inhaled corticosteroids, long-acting beta agonists, leukotriene modifiers to manage chronic symptoms and prevent attacks. Asthma action plan, a personalized plan created with a healthcare provider to manage symptoms and prevent attacks. Lifestyle and home remedies, avoid triggers, identifying and avoiding known triggers. Regular monitoring, using a peak flow meter to monitor lung function. Healthy habits, maintaining a healthy weight, exercising regularly, and managing stress. Complications: asthma attacks, severe exacerbations that may require emergency treatment. Chronic inflammation, persistent inflammation can lead to airway remodeling and permanent lung damage. Reduced quality of life, frequent symptoms and attacks can limit activities and disrupt daily life. Medication side effects, long-term use of some asthma medications can have side effects. Prognosis: asthma is a chronic condition, but with proper management, most people with asthma can lead normal, active lives. Regular follow-up with a healthcare provider is essential to adjust treatment plans as needed and to keep symptoms under control. Prevention: allergen avoidance, reducing exposure to known allergens. Vaccinations, keeping up to date with flu and pneumonia vaccines to prevent respiratory infections. Regular checkups, regular monitoring and follow-up with a healthcare provider to adjust treatment plans as necessary.